Premature ovarian insufficiency, or sometimes premature menopause as it's called, is defined as the loss of ovarian function occurring before the age of 40. Normally this occurs at the age of 50, but in 1% of women it occurs before the age of 40. The diagnosis of premature ovarian insufficiency is usually made on the basis of the symptoms and confirmed with a blood test. Ovarian function can fluctuate, so it's important to do at least 2 blood tests 4 to 6 weeks apart. The loss of ovarian function, and in particular the loss of estrogen, puts women at increased risk of osteoporosis, heart disease, and possibly dementia. In fact, the overall mortality is increased in women with POI. The symptoms include the usual menopausal symptoms of hot flushes, night sweats, etc. Loss of libido is particularly important in the younger age group. Also, vaginal dryness and dyspareunia. There may be dry skin, aching joints, poor sleep, forgetfulness, and mood swings. The most appropriate treatment for women with this condition is hormone replacement therapy. Hormone replacement therapy is safe and alleviates the various climacteric symptoms or menopausal symptoms that we discussed, and also prevents the long-term problems of osteoporosis and heart disease. The answer is yes. Overall, there is a 5% possibility of conception following a diagnosis of premature ovarian insufficiency. However, this is the overall possibility. The possibility is higher when the diagnosis has only recently been made. A woman who has been diagnosed with premature menopause many years ago is very unlikely to get pregnant. Women with this condition can get pregnant naturally, though the possibility, as we said, is very low. There is no medical treatment to enhance that small chance of natural conception, which means that essentially the only viable treatment option is IVF using donor eggs. HRT is not contraceptive, so women who are keen to avoid a pregnancy should use additional contraception, either a barrier method or an IUCD or a Mirena.